Hello, my name is Dr. Sourav Das. I am a consultant psychiatrist with Somnos Sleep Clinic. I am also attached as a visiting consultant with Medica Super Speciality Hospital Kolkata and Iris Multi Speciality Hospital Kolkata. I work as a consultant psychiatrist dealing with various kinds of patients, including those suffering from schizophrenia. And I do deal with general adult psychiatry, particularly those who have various kinds of psychotic disorders and addictive disorders in my routine clinical practice. Talking about different types of schizophrenia, we have to understand schizophrenia is a heterogeneous disease. It can present with a lot of different symptomatologies. To help in diagnosis and management, it has been divided into a few types or subtypes. For example, the most common subtype is paranoid schizophrenia, in which people become intensely fearful or that someone will harm them, maybe kill them, and it can be they can present with suspiciousness that someone is plotting against him or her, someone is having an affair with his or her spouse. So these are the common symptoms of paranoid schizophrenia. It's one of the types, in fact the most common type. Another type is called catatonic schizophrenia, in which the patients show abnormal types of posturing for long periods of time. They make various facial mannerisms and grimacing without any reason. They tend to resist any attempts to touch them or talk with them, and they become very stiff, refusing to eat, refusing to sleep. They just have one position for a long period of time. So that is catatonic schizophrenia. Another subtype is called hebephrenic schizophrenia. This is in fact the most serious type, or rather this is the type which has the worst outcome and prognosis. This hebephrenic schizophrenia, what happens is that it affects people who are around 14 to 15 years of age, very early in their lives. Gradually the family members complain that the person has lost interest in doing things, has become more reserved, does not talk with others much, spends time looking at the mirror for hours together, often making faces while looking at it. The person can look at his or her body parts like fingernails and smiling to himself, sometimes muttering to himself, occasionally talking about a few this and that, suspiciousness, fearfulness, nothing very concrete, but overall their personality gets deteriorated, so much so that the person becomes almost like a person having intellectual disability. But the person had been born without an intellectual disability. The person had all their developmental milestones, like the time of walking, the time of talking, all these things were very normal till about this 14-15 years of age. So this type is called hebephrenic schizophrenia. There is another type called undifferentiated type, in which there are the features are a mixture of all these three types I had mentioned. There is also another type called post schizophrenic depression. For example, the person had some symptoms of schizophrenia a while ago, but currently the person is not having any such schizophrenia symptoms actively, but the person is having depressive symptoms. So that is another variety of schizophrenia. Another variety is residual schizophrenia, in which the symptoms were very strong earlier, now had become very limited, but that is present for at least 1 year or more. Another subtype is called simple schizophrenia, in which there is no psychotic symptoms as such, but the person gradually starts decreasing his or her activity, and they become they sometimes talk eccentric to others. They does not do any work, loses productivity, loses any interest, and spend times lying on bed altogether thinking about something. So this is a very rare diagnosis. Actually, we do not always diagnose people with simple schizophrenia because of that, but theoretically it has been taken, it has been given a name. Now these were the common types of, or the different types of schizophrenia which has been classified for the last couple of decades, but recently concepts have changed, and it has been seen that these different types are not very separate. Why? Because a person may present with one type at one point of time, a few years down the line can develop into another subtype. So these are not very discrete. So currently in the latest psychiatric classification system called the DSM-5, all these subtypes have been abolished, and right now there is only schizophrenia. So that is all for today. We'll meet again. Thank you.